We often think of nurses as simply caring and compassionate, right?
Yeah.
Someone who's there for us when we're feeling vulnerable.
Definitely. That's the image most of us have.
But what if we told you that behind that familiar, comforting image lies, well, the centuries-old journey? It's packed with complex ethical challenges, huge scientific leaps, and this constant evolution of what it even means to be a nurse.
It's way more intricate, really, and demanding than you might initially think.
So today we're doing a deep dive into the foundational elements that truly define nursing in today's world. We've got a great stack of sources here, historical accounts, modern ethical dilemmas.
Definitions of nursing theory,
hmm
the criteria that
Yeah.
actually establish it as, a robust profession.
Our mission is basically to pull back the curtain on this vital field. We want to offer you a kind of shortcut to understanding its full depth.
Yeah, and our goal is to extract the most important nuggets of knowledge to help you understand not just what nurses do, but why their role is so critical and multifaceted, often in ways you might not expect.
Right. You're going to gain a truly well-informed perspective, we hope, on a profession that genuinely touches all our lives.
It really does.
All right, let's get into this. Imagine being a new nurse, okay, fresh out of school, and suddenly you're facing a situation where patient safety is at risk.
Mm.
Speaking up feels incredibly daunting, doesn't it?
Oh, absolutely.
And this isn't just like a hypothetical, it's a very real test for many nurses.
A real ethical tightrope.
So our sources introduce us to Brian. He's a new nurse working on a medical unit. Now, for the last couple of months, the hospital administration has been really hammering home hand hygiene.
And for good reason, right?
Exactly. A client recently died from a nosocomial infection that's a hospital-acquired infection. Grim stuff.
Very serious, sets the stage.
So Brian sees Dr. Wells, a senior physician, enter a client's room without using hand sanitizer or washing his hands at all.
Wow. Okay.
Brian is, understandably, pretty concerned for the client's safety. He knows this is completely against hospital policy.
But he's new.
He's new, he's worried about confronting a senior doctor, fears repercussions. What does he do?
And what's truly remarkable here, I think, is that immediate, intense conflict Brian faces.
Yeah.
It's not just about, ticking a policy box.
Bro.
It's this fundamental clash.
Yeah.
His professional obligation to the patient versus the very real hierarchical power structure in a hospital.
Yeah.
It raises some critical questions, like what are his options if he stays silent? What are the potential outcomes if he speaks up?
And maybe more importantly.
What are his ethical and legal responsibilities here as a nurse, regardless of being new?
And the stakes, our sources really highlight this, they're incredibly high.
Hmm.
If Brian failed to speak up or, report the doctor and his client later got a nosocomial infection, maybe even a life-threatening one.
He could be held responsible.
Well, it could be. The family might even think about suing. That's a huge weight on a new nurse.
It really showcases the unique pressure nurses are under to be advocates, always.
Unwavering advocates.
And stepping back for a moment, Brian's situation, it's not just about hospital policy. It's a stark illustration, really, of how every nurse, no matter their experience level, is positioned as this critical ethical gatekeeper.
Right.
They often face immense pressure to challenge authority for the sake of a patient. It highlights nursing's unique burden, not just to care, but to be that advocate, even when it's professionally scary.
And carries serious legal weight.
Exactly. Legal and ethical implications abound.
Okay, now let's shift gears slightly. Let's look at another situation from our sources. It seems everyday, but it's just as complex ethically.
Okay.
We have Sue, an RN. She's helping her neighbor, Judy, who has an infected cat scratch. Okay.
Common enough scenario.
Sue, probably with good intentions, examines the wound, and then she suggests Judy needs Keflex, an antibiotic.
Okay. And this immediately begs the question, is Sue acting appropriately here? As a nurse, I mean, but in this informal, neighborly setting.
Right, where's the line?
This scenario probes the very core of a nurse's professional boundaries. What exactly is the role of a nurse versus a physician?
Especially outside the hospital wall.
Precisely. Is advising on specific medication, like Keflex, within the scope of her practice? Especially for a neighbor.
It's not just about being helpful, is it?
No. It's about the potential for misdiagnosis, maybe inappropriate treatment, and the significant legal and ethical dilemmas that can pop up when you blur those lines.
Yeah.
A nurse's license and their scope of practice are incredibly specific. They're designed to protect both the professional and the public.
So you see, these aren't just textbook examples.
Not at all.
These are real-world, high-stakes decisions nurses are navigating constantly, daily even,
They really illustrate the profound moral weight, the legal implications of the role.
and why their judgment, their adherence to professional boundaries, is just so critical.
Absolutely.
Yeah.
And for you as a patient, understanding these boundaries kind of reinforces the trust you place in the system. You know that each professional is operating within a defined, accountable scope.
Okay, so connecting these modern, ethically charged situations, how do they link back to the origins of nursing? Was patient advocacy always the central, or did it, evolve?
That's a great question. Let's trace how the public perception and the actual role of nurses has shifted so dramatically over the centuries.
Our sources start with what they call the folk image of the nurse,
The very beginning.
where the main job was basically nourishing and nurturing kids, caring for older folks, family members. Skills were learned mostly through trial and error.
And they were seen as just a caring person, right? Using common sense, maybe some intuition to help the sick.
Exactly, just basic human caring.
But what's really fascinating is how that initial informal caring started to morph into something more structured, more organized.
Yeah.
The transition to the religious image of the nurse during the Christian era was, well, absolutely pivotal. Think about groups like the Sisters of Charity.
Right, founded in France in 1633.
By St. Vincent de Paul, yeah. And later in the U.S. by Elizabeth Bailey Seton in 1809. They began to systematically organize care.
It wasn't just individuals anymore.
No. Alongside various monastic orders, you had the Knights Hospitallers. Others, they didn't just offer comfort. They actually established hospitals, often near monasteries.
And they cared for.
The poor, orphans, widows, slaves, prisoners. Their commitment was deeply rooted in religious faith, and it started to formalize care delivery on a scale never seen before.
But stepping back for a second, not all the shifts in nursing's image were positive, were they?
No, definitely not.
Here's where it gets really interesting and honestly pretty dark. The Reformation in Germany, starting around 1517, it brought a stark shift.
The servant image of the nurse.
Yeah, this period unfortunately kind of relegated nursing to uncommon women, often those on the society's margins, prostitutes, prisoners, paupers, drunks.
A really negative portrayal, famously captured much later by Charles Dickens, describing the dark ages of nursing. Care given by people who are often uncaring, sometimes even cruel.
Such a contrast.
And that negative image profoundly hampered nursing's development as a profession. It made it incredibly challenging for, quote, respectable and desirable persons to enter the field for a long time.
But even then,
Even during those tough times, pockets of dedicated, often religiously motivated care continued to advance. You still had groups like the Sisters of the Holy Cross, founded in France and then Michigan in the mid-19th century.
expanding hospitals, orphanages.
Exactly. And notably, in Canada, the Ursuline Sisters didn't just found the Hôtel Dieu de Quebec way back in 1639.
They started the first staff training program there.
Yeah, which was incredibly forward-thinking for its time. And we also see the deaconesses at Kaiserswerth in Germany, led by Theodor Fliedner.
Right. They established the first Protestant hospital in the U.S., in Pittsburgh, 1849.
So progress was still happening, albeit sometimes against the grain of public perception.
And as we move into the late 18th and then the 19th century, we start seeing these glimmers of early formal education emerging, pushing back against that servant image.
The beginnings of professionalization.
Our sources highlight Dr. Valentine Seaman. He initiated instruction for nurses at New York Hospital way back in 1798, covered things like anatomy, maternal nursing.
Pretty early.
Then Dr. Joseph Warrington provided obstetric training in Philadelphia in 1839, and a really significant step. Elizabeth Blackwell converting Bellevue Hospital into a training center in 1861.
Establishing dedicated training spaces.
But crucially, 1873, that's when Linda Ann Richards graduated from the New England Hospital for Women and Children. She's recognized as the first Black nurse.
A true pioneer.
And following these pioneers, the 1870s, 1880s saw this boom in nursing schools across the U.S. and Canada. Places like Bellevue, Johns Hopkins, Montreal General.
Laying the groundwork, really building the foundations for nursing as a recognized profession.
So what this whole historical journey really shows us, especially for you, the listener, is just how deeply ingrained these societal perceptions are. In the long, really arduous battle it's been for nursing to be seen not just as a service, but as a skilled, respected professional calling.
It definitely wasn't an overnight change. Centuries in the making, truly.
So, okay, with this incredible, sometimes challenging history, how did nursing make that leap from just a caring role to a robust, recognized profession grounded in science, specific knowledge.
Yeah, what defines it today as this indispensable profession?
That makes it tick.
If we connect this to the bigger picture, the movement towards genuine professionalization, it required establishing clear, measurable criteria,
Hmm.
much like other respected fields, medicine, law.
Right. Standards had to be set.
Exactly. This involved developing a specialized body of knowledge that was unique to nursing, and critically, moving education out of a purely apprenticeship model
Learning on the job.
and into institutions of higher learning, giving it that academic rigor.
And that crucial shift, as you pointed out, is exactly what our sources detail when they lay out the 7 criteria defining nursing as a modern profession.
Let's walk through a few key ones.
Okay. First, there's the possession of a body of specialized knowledge. And this isn't just knowing facts, right?
No, it's about the unique synthesis nurses do, bridging biological, social sciences, humanities, seeing the whole patient.
A holistic perspective, often missed in more siloed medical views.
Precisely. Then second, the use of the scientific method to enlarge the body of knowledge.
Meaning,
Meaning nurses don't just follow orders, they systematically gather data, identify problems, develop alternatives, evaluate care. They fully embrace evidence-based practice in their daily work.
okay, that makes sense. What else?
Absolutely. Building on that, another vital criterion is education within institutions of higher education.
Moving into colleges, universities.
Right. This ensures a broader, more theoretical grounding, though, there's still ongoing debate about the perfect balance between that and hands-on technical training.
Sure, the theory versus practice balance.
Then we have control of professional policy, professional activity, and autonomy. This is huge.
What does that entail?
It means nurses are responsible for planning, implementing, and evaluating client care. They develop policies, protocols.
Taking ownership.
And in some settings, they're eligible for direct reimbursement from insurance companies, sometimes called third-party payment. That allows for greater autonomy, more direct access to their specialized skills.
Okay. And then the foundation of any real profession.
A code of ethics, essential.
Organizations like the American Nurses Association, the International Council of Nurses, they've developed comprehensive codes.
Setting stringent standards for ethical practice.
And this isn't just like a rule book.
No, it's the moral backbone. It transforms tasks into a kind of sacred trust, elevating nursing beyond just a job to a calling with inherent, non-negotiable standards.
And finally, nursing as a lifetime commitment, encouraging growth, ongoing education, clinical pathways.
And service to the public, which is really the core of altruism in healthcare.
That service aspect is key.
What truly stands out here is how these criteria didn't just define nursing. They solidified its identity, elevated its standing. They provided the necessary intellectual depth.
It's not just about tasks anymore.
Exactly. These criteria aren't merely academic points. They're the intellectual scaffolding that allows nurses to tackle everything from, say, optimizing a patient's physical environment, like Florence Nightingale emphasized,
The basics, but crucial.
to navigating complex human relationships, which Hildegard Peplau explored, or Jean Watson delving into fostering that profound human connection, the caring moment that defines true healing.
So different theorists focused on different aspects.
Each one chipped away at the how and why of effective care, moving us light years beyond just common sense nursing.
So you can really start to appreciate how nursing evolved from that simple folk image to this highly sophisticated profession, grounded in science, ethics, a unique body of knowledge, all directly impacting the quality, the rationale behind the care you receive.
It's really a testament to centuries of intellectual development and struggle.
So with this really robust professional foundation now in place, what does the future look like for nursing?
Yeah, where is it headed?
And how do we ensure consistent, high-quality care everywhere, globally? How do we make sure every Brian and Sue is supported and able to provide the best possible care?
That brings us to a crucial point. How do we track, evaluate, and ultimately improve nursing care on a large scale?
It doesn't just happen magically.
No, not by accident. It led to decades of dedicated research, policy development, the establishment of formal standards to guide the profession. It was this relentless push for excellence.
And our sources really show just how much effort went into this standardization and improvement. There's this long list of key milestones.
Reports, studies.
Yeah. Like the 1923 Winslow Goldmark report, that was a real game changer. Addressed public health nurses, teacher training, really raised the bar for nursing schools.
Setting benchmarks?
And then Esther Lucille Brown's Nursing for the Future in 1948 advocated strongly for nursing education to move into universities.
We talked about that shift.
And significantly for recruiting minorities, which was a huge step forward for diversity, for inclusion in the profession.
Absolutely vital. And these reports weren't just, academic papers gathering dust.
No, they were blueprints.
Blueprints for transforming the profession, driving continuous efforts through the 60s, 70s, 80s, 90s, focusing on quality, credentialing, workforce issues, health promotion.
Always pushing forward.
And the remarkable thing here is this continuous, relentless drive to refine and standardize. This progressive effort, especially in recent decades, led to something crucial: the development of unified language and classification systems in patient care.
Standardized language. Why is that so important?
Well, these systems are absolutely essential for collecting robust data, conducting meaningful research, ensuring consistency in care delivery across different hospitals, different regions, even different countries.
So everyone's speaking the same nursing language.
Exactly. Think of it as creating a universal vocabulary for patient care, so everyone understands precisely what's being done, why it's being done, and what the outcomes are.
That's a powerful concept. And these standardized languages, they're the bedrock for clear documentation, effective research, seamless communication. Our sources highlight several key systems. There's NANDA International.
Right, that provides a taxonomy of nursing diagnoses, a standard way for nurses to describe their clinical judgments about patient responses.
Then the Nursing Intervention Classification, NIC.
That's a comprehensive, standardized language describing the treatments, the actions that nurses actually perform.
And the Nursing Outcomes Classification, NOC.
That measures the patient or family caregiver states like pain levels, mobility, knowledge, that are responsive to those nursing interventions. It tracks progress.
So NANDA, NIC, NOC, they cover diagnoses, interventions, outcomes, kind of the core loop of care.
They're foundational, yeah.
But our sources also mention others, right? Like the Omaha System for Community Health.
Yes, and things like the International Classification of Nursing Practice, the ICNP, which is vital for global data comparison.
The key takeaway seems to be this sheer commitment to creating a unified language across all aspects of care, from specific specialties to international benchmarking.
It allows for truly global collaboration and learning, improving care everywhere.
Okay, so let's unpack this. These classification systems are like the backbone of modern healthcare data. Better tracking, analysis, consistent care.
Definitely. But the broader implication here connects back to something we discussed earlier.
Which is?
Well, the scientific rigor, the standardized language, while those are undeniably vital for the internal functioning and credibility of nursing, the image of the nurse still matters profoundly.
Perception again.
Yes. As you can see from that whole historical journey we traced, how nurses are perceived impacts patient trust, the perception of competence. It's this powerful bridge between that old folk image and the highly skilled modern professional.
So how nurses are seen isn't just PR.
Not at all. It's fundamental to their ability to provide effective care and gain patient confidence. It enables that therapeutic relationship.
And that perception, it can be influenced by surprisingly small details, can it?
It really can.
Our sources give us this great little anecdote. Communication and Action 1.1, affecting your image as a nurse.
Oh yeah, the scrubs story.
Exactly. Johanna, a new grad nurse, loves her pink bunny scrubs. Cute, right?
Maybe too cute for the setting.
Well, her friend Susan, also a nurse, tells her that a client once actually refused medication from Susan because they felt she looked like a young girl and didn't look like a real nurse in her less than formal uniform.
Wow, that's great feedback.
Right. Susan then realized, okay, maybe I need a more professional appearance. It's a small thing, scrubs, but it speaks volumes about how patients perceive competence, trust, even today.
Even with all the advancements, image still plays a role.
So from those historical struggles to formalize their knowledge, all the way to the future of standardized practice, nurses are constantly evolving.
Constantly adapting and growing.
And even the smallest details, like a uniform, play a part in how their vital, highly skilled role is perceived and trusted by you, the patient.
It all ties together.
We've really journeyed, haven't we? from ancient caregivers facing those first ethical dilemmas
Through the Dark Ages, the religious and servant images,
to today's highly structured professional criteria, standardized languages. It's been quite a ride.
and along the way, we've seen that the role of a nurse is far more dynamic, far more demanding than many might realize.
It encompasses ethical advocacy,
Deep historical roots,
rigorous scientific foundations.
and this constant, often unseen effort to refine their practice and their public image. They really are the bedrock of care.
So considering all of this, the profound ethical responsibilities, the extensive training, this continuous evolution, what might it mean for society if we truly recognize nursing not just as a career, but as the indispensable bedrock of our healthcare system, requiring ongoing respect and, importantly, proactive support?
That's a powerful question. And perhaps, tying it back to us, what responsibilities do we as patients, as a community, have in shaping and supporting that image to empower nurses to truly thrive in their multifaceted, absolutely essential role?
And to ensure we're giving them the support they need to care for us.
Exactly. Food for thought.
Thank you for joining us on this deep dive.